And we're good. All right, Jacob, you want to talk about dues once again?
Yep. Hey guys, when I said that I was going to stop talking about dues, I lied. So basically, it's going to be $60 until November 14th. Remember that you have to fill out the form. $65 November 15th through the 29th. And if you want the bundle, it'll be $75. So contact me if you have any questions, and again, fill out the form.
Yeah, and I forgot to put it on here, but that bundle will go up to $80 on the 15th. That'll just increase with the dues increasing as well. We got Lucky Nationals continued the discount for us, so it's nice. You still have time if you already haven't. And then we have graduation stoles and cords ready for those who are graduating either this December, or if you want to buy them early because you are graduating in the spring, you're more than welcome to do so. You can Venmo or you PRSSA. It's going to be $38 for both of those, and you can do that. You can also email Jacob if you want to pay by check. Logan has one over there if she wants to model it. I don't know if y'all can see her.
Yep, there we go.
They're hand stitched, so they look really good. And then you get a navy blue cord because that is the national color for PRSSA. And finally, without further ado, tonight's speaker is Garland Stansell. He's the PRSA National Chair. He did a great job this year helping to put on Icon Conference. We all really enjoyed that. And I guess his day job is the Chief Communications Officer for Children's of Alabama. Garland, I'm going to turn it over to you now.
All right, Stephen, thank you. And thanks to all of you for having me. I'm pleased to be with you. And thank you for your commitment to the profession and to PRSSA too. So I appreciate you being here and being the future of the profession. I'm going to spend a little bit of time before I share my screen just talking about how I got to where I am today and kind of where my career started and a little bit of that. And then I'm going to share some about healthcare PR because I've spent the last 26 and a half years in healthcare public relations. So I thought I'd share that particular facet with you. But I started much, the same as you did in school, in college. And I started out as an accounting major. I was a business major and accounting major and was in my first semester of my junior year of accounting. It was doing fine, but just realized that was not for me. And I thought, this is the most boring thing that I have ever done in my life. And I can't imagine having a career where I'm just doing accounting forever. And I thought, I don't know what it's going to be, but it's got to be something that allows me to be creative and has a creative outlet. And if you do that with accounting, then you end up behind bars. So I didn't want to go there. And I went the next week and changed majors to mass communications. I went to the University of Alabama at Birmingham, and I changed my major to mass communications with an emphasis on public relations. And I also took journalism classes and broadcasting classes there as well, but loved public relations and found that was the perfect fit for me. And at UAB, I was in PRSSA and ended up becoming an officer in PRSSA and served in a couple different positions, and was there when we started our student agency, the student-run agency, that still exists today. So the agency started then, and that was in the mid-1980s, so a while ago. And the chapter is still going strong, and the agency is still going strong. One of the best decisions that I ever made was doing my internships, and I did an internship with a mortgage banking company, and really enjoyed the internship and what I was doing. I was working a lot on employee communications. After one term of doing that internship, they asked me if I would stay for a second one, so I did. And and then it was time for graduation, and they offered me a job and made a job for me. So that was good. I was able to leave straight from being in college to working a full-time job in public relations and doing primarily, as I said, employee communications and some other things as well. And after about 2.5 years there, the company went through a merger and acquisition, and there were 7 mortgage banking companies that were merged together. And out of that, they decided they were outsourcing all of the communications activities and using agencies for that. So I lost my job. And at the time, I was married, and my wife and I had just built and moved into a new house, and she was pregnant. So not really the best timing to be losing your job. And I started looking and was out of work for about 8 weeks. So not nearly as bad as it could have been, but it was kind of an 8-week time of tension there and wondering what was going to happen. But I got a job at Goodwill Industries of Alabama, and I had not really thought about not-for-profit and working for a social service agency. But I found out that it was a great place and a good fit for me to be there. One, I found that I enjoyed being in a setting where it was more than just a job, but it also was a mission and mission driven and was making a real difference in the lives of people. So I enjoyed working on behalf of people with disabilities and helping the mission of Goodwill, which was providing training for people with disabilities and work for people with disabilities. So I worked there about 6.5 years. I went there as the director of public relations, ended up after about 3 years being promoted, and I was vice president of public relations and development over the PR and the fundraising. One of the great benefits of working for a not-for-profit and social service agency is that one, there's not a lot of budget, so it forces you to be creative, and you've got to learn how to do more with less. And you also don't have a large staff, so it helped me, especially in those first years, to be able to learn to do everything. So I wasn't just specialized in being somewhere that I was only, doing a newsletter, or I was only writing press releases, or I was only doing social media. So I learned to do all of it. And that has served me very well to this day. And then I started looking at Children's Hospital, Children's of Alabama. Was really interested in the mission of Children's, really great reputation in the state and in the city of Birmingham. So I kind of said, okay, I'm interested in that. I found out that they had an opening, and I interviewed and ended up being one of the top 2 candidates for a job. Interviewed, and they offered the job to the other person. So I was really, really bummed and thought, oh, I don't know what I'm going to do now. I continued at Goodwill, worked about another year there, and then out of the blue one day, I received a call from the person who had interviewed me at Children's saying, hey, are you still interested in coming to Children's? And I said, yes. And they said, well, we think we may have a job for you. So I went back, I interviewed, was hired, and it ended up that it was a better position. It paid more, it was a higher level position, and it actually supervised the person that they hired instead of me the year before. So so all things usually do work out. Sometimes you don't see that in the short term, but they do in the long term work out. So I've been at Children's now. I celebrated back in the spring my 26th year at Children's. So I've been there a long time. It's been a great place for me, a really good mission. I love what we are able to do on behalf of children and families, not only in the state of Alabama, but in the Southeast and in other parts of the world in the country. We are one of the top 10 busiest children's hospitals in the country. We have a lot of the top programs. We're ranked, all of our programs, by U.S. News and World Report. And when I went there 26 years ago, we had about 1,900 employees. We now have 5,100. So we have 5,100 employees. It's grown a great deal in the time that I've been there. We typically will see about 14,000 inpatient children a year, and over 650, between 650 and 700,000 outpatient visits every year. We have surgery centers and primary care practices across the state. So quite a sizable operation. One of the great things that I've found about working in healthcare, and even if we're a 501c3, so we're not for profit children's hospital, but healthcare, even though it is meeting that need, it is big business. So you kind of get the best of both worlds. You're in healthcare at the children's hospital or nonprofit hospital. You're meeting needs of people, but yet you are a business, and you're a big, business as well with big budgets. And so that's been a really good fit. So I thought I would, it says host disabled participant screen sharing. I thought I would share the screen to kind of go through some of healthcare public relations.
Go ahead and try again. You should have permissions now.
Are you seeing it now?
Yes.
Okay. Let me get over here to, all right. Is that better?
Perfect.
All right, so we're in football season, although the major teams in Alabama, their games have been canceled this weekend because of opponents having COVID. Both Alabama and Auburn games have been canceled for this week and will be rescheduled. But I'm using a football analogy with this, so the healthcare X's and O's, and just saying, whose playbook is it? One of the things that I wanted to share is in healthcare PR, kind of our playing field, our environment, it is kind of complicated. So you've got providers like the hospitals, their clinics, physician practices, and then you've got all the specialties. So those that are listed there, and there are even newer ones now. And then pharmaceutical, all the drug companies, pharmaceutical companies are in healthcare, PR. So you got, drugs, you got retail pharmacies, medical device companies, consumer health products, nutritional products. So all the things that are more for exercise and diet and your nutrition are part of healthcare, as well as animal health. So everything to do with the animals, food, and the veterinarians and all of that also are part of the healthcare PR environment. Then you've got insurers or payers. So like your Blue Cross Blue Shields and your Cignas and all of those agencies and companies. You also have employer programs, consumer programs, and prevention programs under that. And then the government is a really big player in healthcare public relations, both under Medicare and Medicaid. And then there are also various agencies like the National Institutes of Health and the CDC and so many other different agencies. Then there are a number of PR agencies that specialize in healthcare, or if they don't only specialize in just that, that is a big portion of their agency business. And then you have independent practitioners who maybe don't work for any of these different environments. They have their own, they're an entrepreneur, but they represent primarily healthcare clients. So looking at in healthcare PR, if we're looking at this as kind of a team roster, you've got employees, then these are really your public, your employees, your volunteers, physicians and residents, and the physicians will include fellows as well. You've got students, so the medical students, nursing students, other disciplines. Like in our case, we're not for profit, so we have a board, our board of directors. You have the media, you have your donors, different associations, so like the American Hospital Association, the Alabama Hospital Association, or any of those. In our case, being a pediatric facility, we have the National Academy of Pediatrics. Then you got the consumers of health services in all of those different environments that I just talked about. Condition-specific groups, so if you're targeting to someone with epilepsy or with cancer or with diabetes. And then the government and regulatory agencies are part of your publics as well, and the other segments of healthcare. So we're in the provider, but the other segments, the insurers and all of the pharmacies and the pharmaceutical companies are all our publics as well. So if we look at, what are some of the things that kind of might penalize us? And I've got, we've got laundry on the field, there's been a flag thrown. So sometimes financial challenges in healthcare can be tough. Healthcare is one of the most regulated agencies, so regulatory and legislative. We've got reforms. So the Affordable Care Act, other types of reforms that come, whether they're state reforms, federal reforms, diversity, equity, and inclusion, health literacy, the aging of boomers. And that's really a big strain right now on the healthcare because we've got such a large group of baby boomers who are aging and they're living longer, but they're not necessarily living better. They're living longer and they've got a lot of things wrong with them. So it takes healthcare to keep them going and to keep them, for surgeries and different treatments and all those things. You got the generational challenges of just meeting the needs of now 4 to 5 generations that, we're providing care for, and 4 or 5 generations that are working in healthcare. We have nurses who are 22 years old and nurses who are in their 70s. You've got all of those generations working under one roof. You've got ongoing education. The GME is graduate medical education. So that's the education for physicians and their education, and legal complications, ethics and compliance, mergers and acquisitions. And it's settled down some now, but in recent years, there have been lots of major hospital systems, pharmaceutical companies and others that have gone through mergers and acquisitions. You got bricks and mortar challenges. Most all of the hospitals, many of those were built years and years and years ago. Our hospital now is 109 years old, and it's been around 109 years. And a lot of the hospitals in our country have been around that, 100 years or longer. So their facilities are aging out, and a lot of those aging facilities will not accommodate new technology and the technology that you need. So much like we did, we basically decided it was, instead of retrofitting an old facility, we built a new facility and then used our old facility for professional office buildings and that kind of thing. And there are employment issues and staff shortages. And then sometimes there's just the issue of the day, what is the diagnosis that's getting attention, or other issues that cause, you really demand your attention as a communicator. So I'm looking at healthcare trends, or trends in healthcare, and as kind of the blocking and tackling. There's been a lot of emphasis in the last couple of years around consumer-driven healthcare and customer service, patient and family-centered care, and giving higher value at lower cost. So when I was in graduate school, I got a graduate degree in management, and a paper that I did in a research study that I conducted was comparing the US healthcare system to the European healthcare system. And the major difference was in Europe, their healthcare quality is not the same quality that we have, but their focus has been for quite a long time on prevention and preventive care and taking care of yourself. So in the American healthcare system, ours has been on more quality, and we've got high quality healthcare. And the idea of Americans is, I'll do whatever the hell I want to do, and somebody will fix it. So we will have a doctor who will make me better. And that's kind of where we are with the baby boomers. But fortunately, in recent years, we started seeing a shift in the US healthcare system to more the consumers saying, well, I want to be healthy. The younger generations want to be healthy. They want to make better healthy choices, better diet. And let's not have healthcare revolve around the physicians and the healthcare facility, but revolve around me as a patient, and as a healthcare consumer. So I think that is positive. A lot of that has been driven by insurance companies and the payers because they want to reduce utilization of their service because they make more money that way. So it really helps the insurance companies if you choose to be healthy, and a hospital doesn't have to provide expensive care to you. So the payers and commercial insurance, I already talked about the Affordable Care Act and the marketplaces. So that's changed. This even changed just in the last few years. And then how Medicaid and Medicare work. In the state of Alabama, we have a large Medicaid population. Medicaid primarily is for women and children, for women giving birth and for children. It does pay some for those with disabilities. We have about 60% of our patients at Children's get some form of Medicaid, either fully Medicaid or Medicaid is a secondary payer for them. And it's not really uncommon for that to be similar with children's hospitals across the entire country. And then quality and safety has been a real big focus in looking at outcomes, standardization of care, and performance improvement. So doing studies about certain procedures, heart procedures, or catheterization procedures, or intubation procedures, different things that we've now started looking at standardization of care where hospitals are in consortiums where they are saying, okay, we're going to use this process. Several hospitals use similar processes, and they look at the outcomes to say, well, whose process had the best outcomes, and then they all decide we're going to use, all the hospitals in this consortium say, okay, well, let's use this best process and see if we get better outcome. We get fewer deaths, or we get a better long-term outcome for our patients. So the standardization of care is really helping to improve quality and safety. Some of the other things, as I said, wellness, population health, and prevention and community benefit are things that we communicate about a lot now. The internet's changed a lot about the way healthcare is at least considered from a consumer standpoint. So like WebMD, telehealth, telementoring, and a lot of people will go to the doctor and they've already basically kind of self-diagnosed before they get there because they've looked it up online and they think they know what they've got. So that's changed the way doctors interface with their patients. And then in telehealth, that is something that this country has been toying with for a while. In some parts of the country, it has been incorporated for a good bit, but it really has proliferated during COVID, because people are not wanting to go to the doctor, and the hospitals and the doctor's offices and others are using telehealth so that you see your doctor, and many of you may have done that. You see them over Zoom or you see them over some other platform. So telehealth really has grown in the last 8 months. And telementoring is also where a specialist is mentoring other physicians. So you may have a lot of primary care physicians, general practitioners, or pediatricians who sign on to a platform and they're listening to presentations from a specialist in some specialty, mentoring them to help them better serve their patients in their community. And then technology has certainly changed a lot in the last few years, from electronic medical records, electronic health records, online prescription refill, computerized physician order entry, different portals, patient portals, physician portals, and then technology in biotech and medical equipment. So those are all trends that we communicate about in healthcare PR. Looking at executing strategies around that, a lot of my work is around being trusted counsel, crisis management, pandemic illness, and we've certainly had that this year in communicating around the virus. And we had to pivot really quickly earlier this year to begin communicating to not only our employees, but to patients and families across the state about coronavirus and the pandemic. And so that changed a lot of the way that we operated earlier this year and the communication messages that we were getting out there. We also communicate around funding threats, and Medicaid, Medicare are always, because they're government run and funded, they're always kind of threatened. We're, SCHIP is the state child health insurance program, so every state has some kind of program. And as I said, the graduate medical education, so a lot of communication around that. And then medical errors. So in looking at quality and safety and improvement that I was talking about before, we also are trying to reduce medical errors. So some are human errors, and we look at doing a root cause analysis on any kind of error to say, okay, what happened and can we avoid that in the future? And then sometimes there are device errors from medical devices. Some of the things looking at communicating messages, and the messaging is who exactly is driving the messaging. If we're looking at public relations needing to change attitudes, opinions, and beliefs, you've got a lot of those different attitudes, opinions, and beliefs around public health issues. We see that just this year around different people's views around the pandemic. And is it real, or how bad is it? And does it affect young people? Is it only for old people? Should you wear a mask? Should you not wear a mask? So all of those kinds of things come into play. And then health promotion, education, and wellness, certainly. Are we driving the messaging as a hospital, or who is driving that message? And then we have new services and positions that come online that we're certainly messaging around. And then just representing the brand and stewarding the brand. We are fortunate that we're the only children's hospital in the state of Alabama. We get a lot of patients from Mississippi and Florida Panhandle, and from usually 46 to 48 other states during the year. So we typically are not having to market for patients, but we do need to steward the brand and make sure that we are messaging and that we're community partners and that we're helping to advocate on behalf of families and children to strengthen and steward our brand. Our messaging, once we're getting it out there, sometimes it's filtered. Is it through a legal and regulatory filter? What is our administration and medical staff? Are they sometimes not wanting us to communicate what we need to communicate, or want us to change the message? And we are dealing with that at times. Sometimes the media and journalists may be filtering, and the message is not getting out there exactly as we want it. And then you've got consumers who you're targeting in health literacy. And health literacy is really a big issue in that there could be a language barrier if English is not their first language. It could be that their education level is low, or it could be that they even have a college education, but if your child is, or even your loved one, an older adult, is diagnosed with something really severe, then that's a lot to take in. And you may not really understand what all the doctor is telling you. One, you may not be familiar with the terminology. And two, because you're in a stressful situation, your mind is not absorbing things the way it normally is. So we try to take into consideration health literacy challenges when we're developing messaging. And then, of course, now in the last several years, we've got so much misinformation, disinformation, and malinformation that is out there that we're having to fight, just like a lot of the misinformation about coronavirus or misinformation about other types of illnesses. We're looking at, as most industries are, integrated communications, that we're strategic PR focused, but we have many communication disciplines. In my department, we do not only PR, but advertising and marketing and brand and everything. So if it's communication, we're working on it. And PR becoming more and more research and data driven. This, from a tactical standpoint, that content is everything these days. So text and photo and video and podcast. So we find ourselves doing more and more and more content. Publications, looking at print versus digital. a lot of things have gone online and a lot more digital, but we find ourselves moving back to print some because people get digital fatigue and they get too much email and they see too much, and especially for a lot of the parents and physicians that we're marketing to, they will pick up a print piece. So we find ourselves doing both. And then there's just a changing media landscape. The traditional media landscape is changing a lot. Most of the newsrooms, whether it's television or papers, are just a fraction of the size they used to be. They don't have as many people. So we find ourselves producing news and either putting it on our own channels or producing news, packaging it and sending it to the media, and they use it. So that has changed the media landscape. And then our social and digital media, of course, as in all aspects of communication, are playing a much, much bigger role than they did before. And what I can say in healthcare public relations, as in all public relations, is that the relationships matter, and being able to make sure with all those publics you maintain those relationships, and especially with those that are your customers, your patients, their families. And in healthcare, in pediatric healthcare, we're not just treating the child, but we basically are treating the entire family, which has been a real challenge during COVID because we've had to social distance, so we had to limit the number of visitors when usually we may have, you know, the mom and the dad, the grandparents and the siblings and everybody's there visiting and seeing after the patient. So that's made a change in the way that we deliver healthcare and the way we communicate around healthcare. So that's kind of, I was trying to go really quickly because it was a lot of information, but hopefully that gives you an idea of how complex PR in a healthcare setting is, but also how it's really challenging and I think rewarding, and gives you many different facets. So I will turn it back over to you, Stephen, and I'm happy to answer questions that anybody may have.
Yeah, y'all can just how we've been doing, drop your question in the chat, or you're more than welcome to just unmute yourself and ask. We do have a question from Pritch in the chat. He said, what's your take on the progress toward a coronavirus vaccine?
Yeah, you know, we were talking about that in our breakout room, that it seems exciting that Pfizer and others are saying that we may soon have that, but in some ways it's concerning because typically it's a 3-year process to be bringing something to the market. So then you wonder about, one, the efficacy of it, and then the safety of it. And I was sharing with students that I was in the breakout room with that NBC National News did an interview earlier this evening with Dr. Fauci, and they asked him basically that same question, and he said that he would study the data, and he would look at the data, and that if the NIH and the CDC said that it was safe, and if Pfizer said that it was safe, and the data bared that out, he would take it, and he would encourage his family to take it. So I do think, you know, that will be a concern. One of the other things that I saw is that we've got several, not just Pfizer, but several other companies who expect to have something soon, and they may all treat the virus a little differently and affect the virus a little differently. So one of the things that Pfizer said is it's not like it will eradicate it or mean that you don't get it. It'll work much like the flu shot, whereas it will reduce the likelihood that you will get the virus. And if you do get it, the symptoms will be much less severe. So, you know, and I think it's kind of a wait and see. And at any rate, it'll probably be a year before it makes it out to the market to where we're able to, you know, have a vaccine. It'll be interesting to see how many Americans want to be first in line to take it and how many want to wait and see let other people do it first and let me see how it works. So anyway, that'd be interesting.
Yeah, I think I might be one of those people who says, let's wait and see what happens.
Yeah.
We
All
have,
right. Logan said, I'm graduating in December. Do you have any advice for me as a transition from student to professional? And I think, if you've done an internship, that's great. You've got connections. I would say if you haven't already been connecting with your PRSSA chapter, the professional chapter, to be connecting there, so that you are making those connections as well. And don't think that you have to have a $200,000 a year job the day you leave school, and don't think that. I guess I would say to ease into it so that you're not putting too much pressure on yourself. I don't know if you've already got a job offer or if you're going to be looking, but if you're going to be looking, I would say not to rule anything out, and see what's available. And the first job you get may not be that perfect job, but there are always things that you learn from any job. And what I usually tell our interns too, many times it's more important that you learn what you don't like. So you may be doing the internship, or you may have your first job and you're like, oh, I do not like this. Well, there's value in that. And you're learning and you're thinking, okay, well, I know this is not for me. Yeah, I'd shared with you all that I found that social service and being in a job where I feel like I'm making a difference in someone's lives, that resonated with me. That may not resonate with everybody. And somebody else may be in financial PR and say, oh, I love that. That's exactly what I want to do. But I would say, give that first job a chance, and consider what you can learn from that, both what you like and what you don't like. What is the most rewarding part of your job? What I love about my job is it's different almost every day. It's got variety in it. I like the fact that I get to interact with many different people, not just my staff, but different people at the hospital, different people in the community. And so I like that. And I really like the fact that we are engaged in developing messaging that makes a difference for families. So whether it's something that we're engaged in the community, where we are helping to share messaging about car seat safety, seatbelt safety, or whether it's some materials that we are developing that are given to a mother whose child was just diagnosed with cancer or just diagnosed with diabetes, to help her understand what is this and how do I deal with it? What can I expect? I like that aspect, that we're able to really touch lives in a way that provides useful messaging and information that really helps people make better choices, or help to bring them at least some relief from an educational kind of standpoint. The biggest challenge of working in a nonprofit. Did I miss one? Yeah,
it looks like the biggest challenge was the next one up.
Okay. I think from working in a nonprofit, the challenge of the budget, you don't always have the budget to do what you want. And I did state that does challenge you, and it helps you to be resourceful, and you learn how to do things. You learn how to even go to in the community and ask corporations and others to support your efforts. But sometimes they say no, And sometimes you just don't have the budget to do what you want to do. And you've got these great ideas and you're really wanting to do a campaign, or you're wanting to make a difference, and you may just not have the budget to do it. But you usually can figure out how to do it in some way. I have worked at Children's 26 years. And I do think, a couple of things on how I stay inspired. One, because it resonates with me that of our mission, and I love the mission. If I'm having a bad day, I can walk. My office is 2 blocks and 2 sky bridges away from the main hospital building. So I'll walk over there and can just go into the lobby or into our clinic area and see those patients and their families are all over. Prior to COVID, we did not have wheelchairs in our facility, and we use radio flyer red wagons for the children to be transported all over the hospital. So you see the children being pulled in their red wagon with their stuff, and they're sick and they've got IVs and they're still grinning and they're still just being kids. And so to me, that's inspiring. A lot of times people will say, how do you stand to work at a hospital where you've got all that sickness? Well, 98% of our stories are good outcomes, and they're good stories we tell, and we get to tell those children's stories. And yes, there's a small percentage that's sad, and we lose those children, or they're not good outcomes. But by far, it's great stories and great outcomes. And you can go and see, the people that you're working for and affecting. Pritchett said to talk some about PRSA's efforts on the disinformation, misinformation front. And it's been something that we've worked on this year. We developed a strategic plan, and actually Pritch was on the committee that helped us with the strategic plan, and I was the chair of the strategic planning process. And we rolled that plan out. It's a triennial plan for 2021 and 22. And in that plan, we've got civility, we've got diversity, equity, and inclusion. We've got the convergence of the disciplines, a number of different things. And we didn't specifically have mis, dis, and malinformation in there, but it really does touch a lot of what we're doing around civility, around DE&I, around messaging. And early in the pandemic, a lot of things were out there that were incorrect. And our advocacy committee developed a prescription pandemic to help PR people to be able to look and say, okay, here's what I need to do. How can I help my clients and myself to know what is true and what is not true? And to say, look at trusted sources, fact check, and look at those sources again before you communicate about it or share something in social media or share it with your publics. And in PR, we're seeing more, and I don't know if you've all studied this, but what people are calling dark PR. So where it really is public relations intent on mis, dis, and malinformation, intentionally putting wrong messaging out there, either to get people confused or to make a competitor look bad. We've seen a lot of it this year in what's black PR in the political process, where things are intentionally put out there to make an opponent look bad, whether they're true or not. We have looked at how communicators are really in a unique position to be able to affect and bring change around several things. One is social injustice. The other is misinformation. So we'll be rolling out in about a month a new program that has 4 pillars. Mis, dis, and malinformation is one of those. Civility is one of those. Diversity, equity, and inclusion is one, and civic engagement is the other. And looking at how we are unique in our communities and our organizations to help shape messaging and thought processes around each one of those, and how we can help equip our members to recognize misinformation and disinformation and to help correct that. So we had the international conference week before last. A big focus of the international conference was around those issues as well. And we had several speakers speaking about all of those topics. So PRSA has become involved in that, and from an advocacy standpoint, and going into 2021, we're even going to be stepping that up to help develop resources and things for our members to be able to use to better communicate around each one of those topics.
I have one final question for you, kind of a two-part one.
Okay.
What is the most important thing that you learned when you were in PRSSA? And then what is the one or multiple resources that you would point current PRSSA students towards?
I think it's easy. The thing that I learned the most, that I think is most valuable, that still is with me today, is what I had as almost the last bullet point in that presentation, is that relationships matter. You know, you guys are building relationships now. Some of these relationships, if not all of them, you will take with you for the rest of your lives. The relationships that you build in PRSA, that you build in the companies that you work for, those do matter. And they're helpful to you in ways, and you can be helpful to others through that. So I think the number one thing is that the relationships matter. I'm still, you know, I'm still friends with and see and talk to some of the people that I went to college with and was in PRSSA with. And I'm sorry, what was the second part of that question?
What's one resource now that you would point PRSSA students towards?
You know, I think a local PRSA chapter is a great resource, and those professionals in that chapter. If you don't already have a mentor, look for that mentor. So that is a great resource. So if you end up still being in Oklahoma, or if you're back in your home city or state, if it's not Oklahoma, or you end up being in Bangkok or New York or London, when you were settled there, find a mentor. And then I will say that you know, for me, I think PRSA is a tremendous resource. PRSA's membership in PRSA is a great resource and opens a world to you beyond even what PRSSA is doing now. And we do have, you know, membership as a student, and you're transitioning out. There's a discount over the first 3 years. It's a graduated structure. So you're not paying the full amount at first, and you're paying a reduced amount. The next year's a little more, the next year's a little more, thinking that if you get a job and you're progressing in your job. But we also, within PRSA, have special interest sections. So there are 13 of those, and if you are in finance PR, there is those in finance PR. If you are in tourism and travel, there's a tourism and travel group. If you're in healthcare PR, there's the Health Academy. If you are in government, there's a government group. So that also gives you, I mean, we've got 20,000 plus members in PRSA plus 10,000 student members. But like in the Health Academy, there are 800 members. So that's a much more manageable community, and you get to know those people in that same group. The other thing for you to think about too is one of those special interest groups is called New Professionals. So they're all people who are new to the profession, and they're all people that'll be right there where you are. So you could join New Professionals and then have an affinity group right there with you that would be a great resource for you to call on. So that's really more than one, but those are some resources that I think are important, but they all do relate to the profession and to PRSA.
That's awesome. Thank you very much.
Thank you all.
And thanks for being here tonight. We appreciate it. And it's always a pleasure to be able to hear from you. That'll wrap up our meeting for tonight. Thank you all for being here, and we'll see you guys back in 2 weeks.
Stay safe, everybody. Wear a mask, wash your hands, social distance, all those good things.
Thanks for joining us, Garland. Really appreciate it.
Thank you. Happy holidays.
Thank you, you too.
Ciao.
Bye.